Hi everyone, my name is Julie O'Connor. I am a family physician as well as a solution consultant here at Microsoft. And I'm excited to share with you our DAX Copilot solution and demonstrate how it can help streamline your clinical documentation and well as utilize AI capabilities to assist with additional use cases in your workflow. So let's go ahead and see our first patient. We're going to see Andrea today. Now, Andrea, I know you gave consent to use our new ambient documentation solution, DAX Copilot. Are you ready to get started?
I am.
All right, perfect. I'll kick us off. So I am seeing Andrea, who is a 35-year-old female here today for follow-up of asthma and a new rash. So tell me, Andrea, what's going on? We're going to sit down and review the note that DAX Copilot was able to create for us. Now, our engine is going to be able to parse the relevant pieces of information from our conversation into the appropriate sections of the note, including either the HPI, social history, exam, or assessment and plan. So before we even get the note back, it was able to apply my own style, which is a concise note with a bulleted exam and a bulleted plan. So that's what you're going to see here. And you'd be able to update your note style to fit your own preferences. Now, our 35-year-old patient came in with asthma, experiencing worsening symptoms, needing her inhaler 3 to 4 times a day. Also noticing some chronic itchy rash on the scalp and the left of her foot. So those are the things that were discussed, a great summary, but you can see it was able to filter out the non-medically relevant information, such as her recent or upcoming trip to Banff. Now, coming down to the exam, it was able to capture relevant information that was discussed during the visit, as well as those 2 diagnoses, both severe persistent asthma, psoriasis, and the treatment plan for both. So I have the ability to edit this content if need be with typing or speech recognition through the editing feature, or I can utilize AI to make large edits with a click of a button or unlock additional use cases from that conversation. And we can access that here in the Copilot icon and see our AI capabilities that are available to us. Now, that top feature, Apply My Style, is one of those commonly used AI features. It allows you to access a style wizard in our settings menu and customize your preferences for note output. If you're somebody who likes concise notes, verbose notes, bulleted notes, or paragraphs, you can decide what's appropriate for you in your note outputs. So let me show you how you can do that. Now, coming down here, I personally prefer a concise note style as well as a bulleted assessment and plan. And so each of these different sections, you can create something that's most appropriate to you. So I have a bulleted list, numbered lists. I can even attach additional text to my note that comes back with each note. Now, this is something that I can actually set as an auto style, or something that I can invoke with individual notes if I see fit. Now in this case, I'm going to save my preferences and apply them to this particular note that we have here. And you're going to see how the AI will automatically update this note output and apply my preferences, which include a concise style and a bulleted plan for my review here in this window. I can review this content, and if I agree, I can simply accept and update my note content in a matter of a click of a button. So let's see how what the AI was able to do. So you can see that the HPI comes back, it's more concise, and my assessment and plan is now bulleted, just how I prefer my note output. And again, I can simply hit Apply Changes, and the note itself is updated automatically. In the event that you start a conversation with your patient and you forget to state the patient's gender or preferred pronouns during the conversation, Say you didn't get the appropriate output in the note, or you noticed after the visit that you had them wrong in the first place. You can actually use AI to make a large change with a click of a button. And for this visit, we have she, her pronouns. And so we could easily change them to he, him, or they, them, if appropriate. So let's try that here. And I chose they, them pronouns. And you're going to see how AI is able to update this note, give me a preview of the changes here in this window for review. So as you can see on the left-hand side, you're going to notice blue highlighting in all the text that changes from these updates. And so there's significant changes throughout the history of present illness, social history, and assessment and plan reflecting these new pronouns. And I can simply hit apply, and those changes are made with a click of a button, much faster than if I had to do that manually. Now, this feature is very useful, especially if you're just getting started with ambient documentation. It allows you to get feedback on how you were conducting that visit and what it was able to capture for you as far as a robust note output. It will give you suggestions on other things to include or discuss verbally in future visits to round out the comprehensive encounter that you're doing. So coming up here, you can see that it gives suggestions specific to demographics, document completeness, accuracy, details specific to coding, clarity and thoroughness. I think that is one suggestion that we can review here. It's suggesting that in future, consider talking about patients' past medical history and previous diagnoses. That may be pertinent for a conversation such as this for a more comprehensive note. So that's a perfect example of how we can help drive further value the more you use the product. I want to share with you how you can interact with AI to unlock further value from this conversation. And so let's take a look at our next feature, which is summarize the encounter. Now, this is particularly a useful way to utilize AI. And this would be helpful if you have a workflow where you're interrupted, you're not able to finish the document or review the encounter immediately after seeing the patient, or you're somebody who likes to see a number of patients in a row and come back and do a number of documents all at the same time. This allows AI to give you a concise summary of that conversation, so it's top of mind what you discuss with the patient as you more thoroughly review the draft note document you have in front of you. It's able to give you presenting symptoms, so subjective details from that conversation, clinical observations that are objective, and other pertinent details, again, so that I have more information as I'm reviewing the note output. So down here, you're going to see one called Summarize the Diagnosis Evidence. And this is going beyond just linking pieces of information to the transcript. It's actually comprehensively looking at that conversation, that encounter, pulling out relevant pieces of historical data that the patient stated, as well as objective evidence from discussed labs, diagnostics, and physical exam, and summarizing the different diagnoses that were included in that note. I think this is particularly helpful as users start utilizing ambient solutions. It gives them the confidence of how this technology works and gives them understanding of what's being pulled in and why it's being pulled in. Now, as you can see here, we have our diagnosis of severe persistent asthma. It is able to outline the symptoms, concerns, clinical observations, and the reasoning that was discussed to support that diagnosis. In addition, just below that, we have the psoriasis, and again, that objective and subjective data supporting the diagnosis, as well as linked references from the transcript itself that we can look at so we have a full understanding of what happened and where that came from. I can even actually click on this and it will show me the transcript itself and the particular pieces of information from the transcript. So very useful feature. We're going to utilize AI to transform this conversation and this content into a draft after visit summary. This is something I can give to them in the patient portal or hand to them as a document as they leave the office, considering it's immediately available to me after the visit. So for this patient, we can see Andrea, she came in with her asthma, the new rash. It outlines the symptoms that she was having, the clinical findings, my diagnosis, treatment plan, as well as follow-up instructions, all here for her in easy to understand language for the patient to consume. Now, one of the things I was going to do for this patient was place a referral to the dermatologist. And for new referrals, I do think it's important to include a referral letter outlining exactly why I'm sending the patient over. And what's nice is I can utilize AI from DAX Copilot to help with that task, point of care, as well as with the documentation. And I can access that here in the Copilot button. Now, drafting a referral letter is down at the bottom, and I can use that as a first draft as I conduct a referral over to my local dermatologist. So as you can see here, it's able to outline exactly what's going on with the patient relating to her asthma and the psoriasis, as well as the reason for referral. And so that saves me time, able to get that done efficiently to streamline care for the patient.